Hey everyone, welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and today we are going to talk about a common question that I get, which is, can you be sedated even if it's for a cleaning? If the thought of the dentist makes your heart race, your palms sweat, or you're already planning your escape route, please know that you are not alone. Dental anxiety is real, and there are some solutions that can help. So today we are going to be kind of breaking down the different types of sedation, from nitrous to Valium to even general anesthesia, what's allowed, when's it recommended, and what licenses does your dentist need to keep you safe. So the overall question, can you be sedated for cleaning? The short answer is yes, but it depends on the type of sedation depending on your state and then you're also your dentist's license. In most cases, especially for like routine cleanings, mild to moderate sedation is considered safe and appropriate for patients with dental anxiety, a strong gag reflex, sensory sensitivities, past dental trauma, difficulty sitting, and special healthcare needs. Now let's talk about the different levels. The most common one would be nitrous oxide or laughing gas. This is considered minimal sedation. Think like warm, floaty, and calm. It's a mild inhaled gas. We deliver it through like a small little nose piece that we put on, and a lot of times we'll monitor you with a pulse ox where we can see your oxygen saturation and your pulse, what it feels like. So typically we like to say that it's warm, floaty, and calm feeling. Sometimes you'll get like a light tingling in your hands and feet. You'll feel relaxed, but you'll still be awake. Sounds might feel a little bit farther away, a little bit more distant. You definitely get reduced anxiety and reduced gag reflex. You'll be able to hear the dentist and the assistant. You'll be able to answer questions. It's very fast working, so whenever it gets turned on, within a couple of minutes, you'll start to feel the effect. And then after the procedure is done, you just breathe in 5 minutes of oxygen and you're ready to go. Sometimes it's recommended to kind of have a lighter breakfast so that your stomach doesn't get all upset whenever you've had it, especially if it's your first time. The best news about this is that you can still drive yourself home. You don't need an extra person. You'll feel totally normal once you get up. Is there a license needed for this? Yes, but it's very basic training. It's very safe and effective. This is best for mild anxiety, gag reflex. For kids, it's awesome, and simple cleanings. Next, we're going to talk about oral sedation, whether that's like Valium or Halcyon. Those are considered minimal to moderate sedation. This is where you take a prescribed pill before your appointment. Depending on the medication and dosage, you might feel calm and relaxed, sleepy but awake, less aware of sensations or time, and definitely less anxious. Is a license required? Yes. It varies tremendously depending on the state that you are in. Some states require a moderate sedation permit, even for oral sedation. So sometimes if your dentist doesn't offer it, it might be because they're not certified to prescribe it. The important thing to note about this is you do have to have a driver to and from your appointment. So make sure that you have set that up before you go. The third type of sedation we're going to talk about is IV sedation. This is considered moderate sedation. Just think it's basically between deeper in sedation than the pills, and it requires specialized training. You're still breathing on your own, but you probably won't remember much. You're super relaxed. You have to be monitored continuously. This requires a special permit, so not a lot of dentists do this route. A lot of oral surgeons might. They'll need additional training, including emergency airway. You'll need an on-site inspection at the clinic to make sure that your clinic set up for that. And then there's special equipment that's required as well. The last type of sedation we're going to talk about is general anesthesia. This is what you consider like deep sedation where you're fully asleep. Most of the time it would be considered in like a hospital setting. There are some clinics that are set up where it would be like an outpatient sort of setting. Pediatric offices do this often, and this is where you are fully unconscious. Anesthesia is administered by a dental anesthesiologist, a hospital team, or trained provider with deep sedation permit. A license is definitely needed for this one. You usually need like a state-specific deep sedation license. You need emergency equipment and a special staff that's trained in this as well. I would say for this route, you probably wouldn't need this for a general cleaning unless maybe there's like special healthcare needs for you. But for the most part, I would say nitrous or oral sedation would probably be the best if you are needing something for a general cleaning. I kind of wanted to break down the 4 general steps of sedation just so that whenever you hear the word sedation, it means very different things, and it just depends on if it's from mild all the way to general. You definitely need a driver for general anesthesia. I hope you also understand that there's different specific state by state guidelines on what is allowed and required depending on what the state allows and what the dentist is qualified for. So things that you can be asking your dentist are, what level of sedation are you trained and licensed for? You can even ask, how many sedation cases have you done? Who monitors you during sedation? Do they have emergency equipment and training? And then the dentist will be able to tell you what do they think is the best type of sedation needed for you specifically. We will not be mad that you asked that question. We will be happy that you care and are aware and just want the best for you. So to recap, can you be sedated for a cleaning if you have like severe anxiety? The answer is yes. Mild or moderate is common and safe when supervised. Does insurance cover sedation? It depends is the answer. Sometimes, if it's a medical necessity, there's a lot of hoops that sometimes we have to jump through, but the answer is sometimes. Is sedation safe? With proper training, monitoring, and licensing, yes. We always look through your medical history also to kind of see where you are based on if there is more of a risk for you. So that is also important depending on your medical history. Can a hygienist give sedation? The answer is no. Sometimes it depends again on the state, but they can administer like nitrous depending on the state with the dentist in the building. Is sedation only for big procedures? Not necessarily. Many adults use it for cleanings, fillings, everything. So it just depends on your comfort level and what you want. I will say that a lot of times whenever we do have anxious patients, they do a lot better whenever we walk them through the steps before we lay them back. And so if that's you, just ask your dentist. Be like, hey, I really want to know what's going on. Talk to me before, during, after, so that I know, whatever. And some patients just want to put headphones in and not hear noises, and that's totally fine too. And then, can you eat and drink before your procedure? That also depends. So if you're doing general anesthesia, no, you'll have to wait, depending on what it is, several hours before. And then for nitrous, again, we like to kind of just do a light breakfast or lunch or whatever, just so that you don't have a full stomach coming in. So I hope this answered your questions on can you be sedated for cleaning? The answer is yes, but again, there's different levels and there's different licenses that are required per state. So just ask your dentist what they can offer you. It again depends on your health, your anxiety level, and what the dentist can offer. You deserve a dental experience that feels calm, safe, and supportive. And sedation is just one of the tools that we can use to help. If you have any questions about sedation, dental anxiety, numbness not working, or anything in between, drop your questions in the comments. Please like this video, subscribe so that you don't miss out on our upcoming videos. I'm always here to help. And remember, we are not scary. We're here to make your visit the best that we can. And it's just a very different world that we work in. And so just being able to understand what's going on is really going to help. So thanks for watching. Have a great week. See you next.